Hello everyone, welcome to my channel Anupma Biology Classes, and this is the 7th lecture in the series of Human Physiology. Today we will know about the human skeletal system, and this video is the section B of part 6. In this human physio series, we will collect more knowledge and information related to human body and functioning. So let's take a look at this topic, and in this series now the skeletal system. So at first, what is the skeletal system? A skeleton is the harsh, supportive or protective elements of the animal body, and the study of a skeleton is called osteology. Now we know that in some animals have no skeleton or short of skeleton, like in case of the hydra, flatworms and roundworms, where body cavity has fluid which act as a hydrostatic skeleton, while in other animals there are two types of skeleton, where the first one, that is the exoskeleton, which is found in invertebrates and vertebrates and developed by the epidermis. It consists of hard parts present on the surface of the body, like cells of the snails and clams are composed of calcium carbonate. Arthropods have jointed exoskeleton composed of movable articulated plates. Plates are made up of cuticle, which is chitin, and chitin is a type of carbohydrate. Scales, feathers, hair, claws, nails, hoofs, and horns are examples of exoskeleton elements in the vertebrates. Second is endoskeleton. Endoskeleton developed by the mesoderm. It consists of hard parts present inside the body. The cartilages and bones are the examples of endoskeleton in case of vertebrates. Sponges have spicules of inorganic materials or fibers of protein. Corals and mollusks endoskeleton is calcareous. Echinoderms have hard plates that known as ossicles, and ossicles are made up of magnesium carbonate and calcium carbonate. So, in above all, the endoskeleton does not restrict the growth of body, while the exoskeleton restrict the growth of body. And the exoskeleton is made up of non-living material, while the endoskeleton have living tissues. Now, the cartilage. Cartilage is a very important component of the skeleton, and it is a combination of matrix which contains collagen and elastin fibers and cells which present in lacunae. Cartilage is a kind of connective tissues with firm and abundant intercellular matrix of flexible material. This material is chondrine. Cartilage cells lie singly or in groups of 2 to 4 in lacunae. Chondrocytes, which is cartilage cells, are oval and these are devoid of process. No bone marrow is present in cartilage. In our body, in the embryo stage, first our body made up of cartilage. After that, it mold into bones, and this process of bone formation from the cartilage is known as ossification. After that, cartilage is of three types. These are first one, that is the elastic cartilage, which present in pinna and external auditory canals of the ear, epiglottis, eustachian tubes and the tip of nose. Second is fibrous cartilage, which present in intervertebral disc and in pubic symphysis. And the last one, that is hyaline cartilage, which is present in sternal ribs, and it also present in tracheal and bronchial rings. This is the structure. Here there is elastic, hyaline and fibrous cartilage. After this, bones. Bones consist of tough matrix and cells in lacunae, collagen fibers, blood vessels, nerves and fat deposits. This is the structure of a compact bone, and bones is a solid rigid connective tissue where matrix is composed of tough inflexible material, and this material is known as oosine. Osteocytes. Osteocytes are cells which present in the bones, are irregular and give off branching process in the developing bone. It may have bone marrow in the center, and the bone growth protein is present in the intercellular material of the bone, which is released at the time of fracture for the formation of bone. The amount of bone growth proteins declines with age, and this causes osteoporosis. So, what is osteoporosis? Osteoporosis means porous bone, and this is the type of disease in which the density and quality of a bone are reduced, and when bones become more porous and fragile, risk of fracture increased. So, the skeletal provide the support, shape, protection of organs, site for the muscle attachment, movement, formation of blood corpuscles, and also helps in hearing, breathing, sound production, mineral and fat storage. Now, the human skeleton. And here we will discuss about the part of human skeleton and their different types of bones. So, the first one is axial skeleton and the second is appendicular skeleton. In case of the axial skeleton, it is divided into the four parts. First one is the skull, which is present in the head. Second is vertebral column, which is present in neck and trunk. Third is sternum, which is present in thorax, and the last one is ribs, which also present in thorax region. In these structures, in the skull, it is divided into the following parts like the cranium, face, and hyoid bone. Vertebral column is divided into cervical region, thoracic region, lumbar region, sacral region, and caudal region. So in the previous page, we saw different parts of the axial skeleton. Now the parts of the appendicular skeleton, and it is divided into two parts. First one is girdles and second is limbs. Girdles is divided into the two parts. First one is pelvic girdle, then the pectoral girdle, and the limbs also divided into the two parts. First one is forelimbs and the second is hind limbs. Forelimbs has many parts like the humerus, radius ulna, carpus, metacarpus and phalanges. Like this, the hind limb also has many parts: femur, tibia, fibula, tarsals, metatarsals and phalanges. Now we shall discuss all these parts of human skeleton in detail, and here the complete axial skeleton structure and the complete appendicular skeleton and the position of the parts in the human body. So in the first diagram, that is axial skeleton, you can see all the parts which starts from head, that is skull, and completes on coccyx. And in the appendicular skeleton, you can see the structure from the shoulder, that is the clavicle, which and completes on phalanges. Now the first one, that is the axial skeleton. So what is the axial skeleton? According to the name, it occupies the body's main axis of the body, and it has following structures in which the first one, that is the skull. Skull is supported on the top of the vertebral column and it is present in the head, and the bone of the skull is hardest and densest part of the whole body. It has three regions: cranium, face and hyoid bone. This is the structure of the skull. And in this portion you can see all the 8 cranial bones. So the first, that is the cranium, it is rounded in structure and its cavity is termed as cranium cavity, which encloses brain, which known as the brain box. Cranium is formed of 8 bones: one frontal, 2 parietals, one occipital, 2 temporals, one sphenoid and one ethmoid bones. There are 3 demarcations. Here, the parietals are demarcated from the frontals by a coronal suture. This is the coronal suture. And the parietal demarcated by the occipital by the lambdoidal suture. And from the temporal by the lateral suture. You can see the picture where the position of coronal, lateral and lambdoidal sutures. So here a question is, what is the role of sutures? Sutures help to dissipate the shock of a blow to the head. A large hole, that is foramen magnum, at the base of the skull allows the brain to continue into the spinal cord, which is located in the backbone. And the cranium has auditory capsule that contains 3 small bones, which known as ear ossicles, and these 3 small bones are malleus, which is present in the outer region. After that, the incus, which is present in the middle, and the last one, that is the stapes, which is present in the inner region. And these all 3 bones help in the process of hearing. After that, the second part, and this is the face. You can see the facial bones. Face lies in the anterior part of the cranium and it is composed of 14 bones. These bones are 2 nasals, 2 maxilli, 2 palatines, 2 zygomatic or cheekbones, 2 lacrimals, 2 inferior nasal conchae, 1 vomer and 1 mandible, in which the palatines, lacrimal, inferior nasal conchae and vomer are not visible from the outer surface. Mandibles are responsible for the mastication and speech. After that, the hyoid bone, it lies at the base of the tongue as known as the tongue bone. You can see in the picture, and certain muscles of the tongue and throat are attached to hyoid bone while rest are free. Except mandibles and ear ossicles, our other bones are immovable. So after the completion of skull, it has many functions like cranium protects the brain, facial bones form jaws to support the mouth for feeding, and hyoid bone supports the throat. Now, the second part of the axial skeleton, that is the vertebral column or spinal cord. In the picture you can see this is the complete spinal cord structure, which is curved and 70 centimeter long and present in the mid dorsal line of the neck and trunk. It also called backbone or spine, and it has 33 movable vertebrae which divided into 5 categories. These are cervical, thoracic, lumbar, sacral and coccygeal. Cervical present in neck and 7 in number in case of human. Thoracic present in chest and 12 in numbers. Lumbar present in abdomen and 5 in number. Sacral present in hip and 4 or 5 which is fused. Coccygeal present in the tail and 3 or 5 which is fused. The first cervical vertebrae is atlas and second is axis. In human, vertebral columns have 4 curves: cervical, thoracic, lumbar and sacral, which is located in the neck, thorax, abdomen and pelvis respectively. Cervical and lumbar curves are directed forward. You can see in the picture the cervical and lumbar curves, and after that the thoracic and sacral curves, which shows the backward direction. The vertebral formula for human is C7, T12, L5, S5. Here, the bracket indicates that these sacrals are fused, and after that C, that is coccygeal 3 to 5, which are also fused. So complete 33 to 35 vertebral column present in case of the human. Here C, T, L, S and C represents cervical, thoracic, lumbar, sacral and coccygeal respectively. Coccyx or tailbone is a triangular bone present in the coccygeal vertebrae. Now, you can see here the structure of the common cervical vertebrae and the main structure of the vertebrae, that is atlas and axis. So in the first picture, the arrow indicates the first picture, which shows the hole, and this hole is known as the vertebral foramen, which has ventral border thick called the body or centrum. This structure is amphiplatyan. It means equally flat on all sides. Then remaining boundary is vertebral arc. Each arc of the half of the arc has a pedicel and lamina. The vertebral arc gives off process which are spinous, articular and transverse. Now, the summarized view of a vertebral column, and this is the structure of the spinal cord. You can see it starts from the neck and completes on trunk, and in the complete structure, vertebrae is a bony ring and its whole card the vertebral foramen. The ventral border of the vertebral foramen is body or centrum. The remaining boundary of the vertebral foramen is vertebral arc. Between the centra of the adjacent vertebrae there are intervertebral disc. Displacement of an intervertebral disc called the slip disc. Vertebrae strengthen the neck and trunk of upright posture in standing and walking. Vertebrae encloses and protects the spinal cord. Vertebrae provides flexibility to the trunk, and the upper cervical vertebrae provides free movement to the head in all planes. Now, the third of the exoskeleton, that is the ribs. And in the structure, this is the structure of ribs you can see and their position in our body. Ribs are present in thoracic basket. There are 12 pairs of ribs. Upper 7 pairs are true ribs. You can see in the picture here numbers denote the 12 pairs of ribs, in which the upper 7 pairs from 1 to 7 are the true ribs. After that 3 pairs, that is 8, 9 and 10, are the false ribs, and the lower 2 pair, that is 11 and 12, are the floating ribs. Ribs consist of two parts, vertebral and sternal, in which the vertebral part is long and bony, while the sternal part is short and cartilaginous. Ribs protect the heart, large blood vessels and lungs, and the lower part of the ribs protects the kidney. Then the structure, that is the sternum. In the picture you can see the anterior view of a sternum. Sternum is present in the middle of the front wall of the chest, and it has three parts: manubrium, body and the xiphoid process. In the picture this is the manubrium, after that body and the xiphoid process. Manubrium shape is like a dagger, body is like a blade, and xiphoid process is like a tip. Sternum help in the process of the respiration, and it also takes part in the protective thoracic basket formation. Here the 7 pairs of the true ribs are attached to the sternum. After that, now the appendicular skeleton, which is the second main part of the human skeleton, and appendicular skeleton is placed in the side axis, and here it consists of girdles and bones, in which we see here the pectoral girdles and forelimbs in one part and pelvic girdle and hind limbs in second part. So the first one, that is the pectoral girdle and the arm bones. This is the structure. You can see here the complete pectoral girdle and arm bones and the position in our body. Pectoral girdle present in the upper region of the thorax, and it consists of two bones, scapula and the clavicle. The clavicle also called collar bones, and it provides articulation to the arm bones and affords attachment to the certain muscles of the arms. Now each arm consists of 30 bones. It means 30 bones are present in each arm. So, in our body, there are two upper arms. It means 60 bones are present. These bones are humerus, radius, ulna, metacarpus, carpals, and phalanges. So, humerus in the upper arm. In the picture, you can see after that the radius and ulna, which is present in the forearm. Then the carpals, which is 8, which is present in the wrist, 5 metacarpals in the palms, and the 14 phalanges in the finger. Phalangeal formula for the human is 2 3 3 3 3, and the bone of the arm provides strength to make the arm effective in working with them. Now the second, that is the pelvic girdle and the leg bones. This is the structure of a pelvic girdle. It is the lower part of the trunk. It consists of three bones, that is ilium, ischium and pubis. In the picture you can see the structure and position of these three bones in the pelvic girdle, and these three bones fuse to form hip bone, which has acetabulum. It provides articulation to the bones of leg, and it transfers the body weight to the legs. This is the complete structure. And each leg has 30 bones. These bones are femur in the thigh, patella in the knee, tibia and fibula in the lower leg, 7 tarsals in the ankle, 5 metatarsals in the sole, and 14 phalanges in the toe. In the picture you can see this is the femur, then patella, tibia, then fibula, then tarsals, metatarsals, and after that phalanges and their position in the leg. Now the phalangeal formula for the human foot is 2 3 3 3 3. and the bones strengthen the leg to the bare body weight to balance the body while standing and to aid in locomotion. An average adult human consists of 206 bones in our body. Now, you know that there are some different in the male and female skeleton. And these differences are: in case of the female, skull is lighter, shoulder narrower, sacrum short but wide, pelvis wider for the opening to facilitate childbirth, coccyx is very movable than man. Now, here is the complete human skeleton and the total number of the bones in the human skull. Here is the summary: the total axial skeleton and the total appendicular skeleton. So, according to this view, you can see here the whole structure of the bone, which is total 206 in number, in which from the top, that is skull, has 29 bones, which are distributed like in cranium 8, face 14, hyoid 1, and ear ossicles has 6 bones. Then vertebrae, which has 26 because 5 sacrals fused into 1 and 4 coccygeal fused into 1. In ribs 24, that is 12 pairs, and in sternum 1. So these all are the total axial skeleton, which is 80 in number. After that, the appendicular skeleton, in which the pectoral girdle 4, in which 2 scapula and 2 clavicle. Forearm has 60 bones, in which humerus 2, radius 2, ulnar 2, carpal 16, metacarpals 10, and phalanges has 28 bones. The pelvic girdle is 2 in number, which combination of ilium, ischium, and pubis, in which 3 fuse to form 1 on each side, so 2 in number. Then legs has 60 bones, in which femur is 2, patella 2, tibia 2, fibula 2, tarsals 14, metatarsals 10, and phalanges 18, 28. Sorry. So, when you will add all these bones, you will find that 206 bones are present in our body. And at last, joints. So, what is joints? The structural arrangement of tissues which connect two or more bones together at their place of meeting is called a joint, and joint makes the body flexible and allows the growth of the structure they connect. The study of joint is called arthrology. After that, the type of joints. So there are three type of joints. First one is fibrous or immovable joints. It occurs between the bones of the cranium and in the tooth socket. Immovable joints are often called sutures. So you can see in the picture, these are the sutures which are present in the skull. Second is cartilaginous or slightly movable joints. They are found between the centra of vertebrae at the pubic symphysis and between the ribs and sternum. This is the structure of the pubic symphysis. In the picture you can see, which is the attachment point. After that, the third one, that is the synovial joints or freely movable joints, and which are of following types. This is the picture of the synovial joint, and the first one is ball and socket joint, which is present in shoulder joints and the hip joints. Then the hinge joint, which is present in knee, elbow joint, ankle joint, and joint between the phalanges. Then angular, ellipsoid, or condyloid joint. Wrist and metacarpophalangeal joints are known as this. Gliding joints, joints between zygophyses of the vertebrae, between the carpals in the wrist and tarsals in the ankle, between the sternum and clavicles. Pivot joint, joint between the atlas and axis vertebrae, upper end of the radius and ulna articulation. Saddle joint, joint between the metacarpals of the human thumb and the corresponding carpals. The elbow joint is the combination of hinge and pivot joint. So, all the movements which occur in animal are only at the joints. So, this is the end of skeleton system, and in this you understand about the bones, cartilage, and skeleton of humans and about the joints. Now, the next video will be on the nervous system of the human beings. So for more such tutorials, stay tuned with the Anupma biology classes. If you understand the skeletal system by this video, like and share it, and subscribe to my channel Anupma biology classes. If you have anything which you didn't understand in this video, or you want some other videos, write it down in the comment section below. Thank you for the watching.